Well, good morning, and thank you so much for being here. I'm here with Dr. Mike Shepherd, the Group Director of Operations for Health New Zealand in the Auckland District. And today I'm pleased to announce that Health New Zealand will be delivering an additional 75,000 diagnostic procedures over the next year through its $65 million Diagnostic Improvement Plan. Around 40,000 New Zealanders are waiting too long for critical diagnostic scans such as MRIs, CTs, colonoscopies, echocardiograms and colposcopies. Those New Zealanders are needing answers to what's wrong, and with those delays it's leading to anxiety for patients and their families, while also holding up treatment and adding pressure on our hospitals. This investment, but also importantly this plan, will expand access so that patients can get answers sooner, doctors can diagnose problems earlier, and treatment can begin quicker without delay. And for many New Zealanders, this is going to be life-changing. Over the next year, the program will deliver an additional 74,950 additional procedures through both public and private providers, including 64,000 additional radiology procedures, that's CTs and MRI scans, 7,100 additional colonoscopies, 2,200 cardiac tests, and around 1,650 colposcopies. These scans, these tests are going to be critically important to help patients getting diagnosed with things like bowel cancer, colposcopies for cervical cancer, radiology procedures for other important diagnostics. We're also investing in the workforce by expanding training places in radiology and echosonography to meet future demand. This initiative is also in addition to the $30 million investment in community-referred radiology, which has recently been launched by Health New Zealand, which supports GPs to be able to refer directly patients for these scans, both to through the public health system or to private providers to cut out unnecessary waits. This is about putting patients first, faster access, faster answers, and faster treatment. And with that, happy to take questions.
Minister, is this a new announcement or is this a re-announcement?
No, it's a new announcement, so it's a new plan, and I can get Mike to talk to the work that's been done putting this plan together. Ultimately, the number of New Zealanders waiting for diagnostic procedures has been increasing. It's not good enough, and this plan has been designed with clinicians across the country so that we can increase access to these critical diagnostic procedures, speed up access to answers, and that means getting patients the treatment that they need sooner. But happy to get Mike to talk to the work that's been underway to put this together.
Minister, just
Sure.
quickly on... Oh, sorry.
Mike wants to...
Oh, okay.
Yeah. So look, I think this is critically important for our patients. Timely access to tests. Patients have been waiting too long for these really important tests, and we're really focusing on the CTs and the MRIs, the echocardiograms, the things that are really life-changing for patients through their pathway of care. So this is definitely an extra boost in our diagnostic delivery. It supports our boost in our elective plan, and it really supports the community-referred radiology program that we've got, as Minister mentioned, around primary care. So these things come together, and we've built this as an integrated program, building capacity within our system at the same time as delivering increased diagnostic tests.
Minister, the $65 million, where's that come from?
Well, two places. Part of it's come through efficiencies in the outsourcing budget, so being able to do better deals, we're able to then make further investments. And secondly, a pool of money that was set aside as part of our $1.37 billion uplift in funding for Health New Zealand in the budget to support our health targets. And so this is critically important to meeting our health targets. Diagnostics is an important part of making sure we get faster cancer treatments. It's critically important so then we can diagnose and get people the elective treatments they need. It's also really important for those emergency departments and making sure that hospital flow is being facilitated, because a large number of patients end up waiting either a long time in emergency departments or in a hospital bed because they need a CT or an MRI. So speeding up access to those treatments helps us support those critically important health targets which we know save lives.
Minister, the Apex Union recently put out some figures around this, and they called Health New Zealand's response lethargic to the radiology crisis. Is this your response to this?
Well, we have, I've said in the press release that you'll see today that I expect Health New Zealand to work closely with the Apex Union to make sure this investment is successful. They have raised a number of really important points in that report. I read that report. I met with the union, and I believe this boost in terms of diagnostics does address a number of their concerns which they have rightfully raised. And as I said, I've asked Health New Zealand to work closely with that union to make sure that this is successfully delivered for patients. And as I said, it's about maximising capacity across Health New Zealand, also working to outsource where needed, so that patients get faster access to answers, which then leads to faster treatment, which is so important for patients.
Just a quick question for both the Minister and Mr. Shepherd. So can you give us an example of how long patients are typically waiting at the moment for diagnostics such as a colonoscopy or MRI? And with this funding, how much are you trying to improve that by? How much are you trying to, do you have any targets?
Yeah, so there's a range of targets for all of the different measures, CTs, MRIs, colonoscopies, then it's broken down into the urgencies of those as well. And so there's a range of targets. I can get Dr. Mike Shepherd to speak to that. But the additional investment here and capacity will mean that we can make improvements across all of those. But I say there's lots of different, it's measured in lots of different ways for urgency and then for routine appointments. I'll get Dr. Mike Shepherd to speak to that in detail.
Yeah, look, I think the Minister's characterised it well. It is quite complicated, but I think the first thing is, this is going to uplift all of those wait times through various urgency categories and through these various modalities. I think the best example is probably around CT and MRI. I think that we're moving towards the target of 42 days waiting for those things. So I think this boost will get us a good way towards that target. We're yet to do some further calculations in terms of where that actually gets us, but that's our expectation. We want to head towards that as an appropriate kind of time range, and we've got similar metrics through all of these other measures.
So 42 days, so where are we at the moment?
Oh, so it's very variable through the country, and so that's what I mean, and it depends on your urgency code. So, I think it's difficult to put a number on that across the country, but I think what we're expecting is that this boost will get us much closer to that number across the country.
And if I just speak to that, one of the things that this funding will also do is, one of the challenges that Health New Zealand has after the merging is that actually every single district has different systems to actually pull that data together. So part of the investment here is actually to put in place a nationwide system so that Health New Zealand can actually have accurate, up-to-date data which it can then report against nationwide. And that's something which, again, is part of the critical work that's really important so that the Health New Zealand can deliver a consistent service nationwide for patients and provide that access that they need. So that is part of it, so that we can provide that clarity and that evidence base.
Mr. Brown, what do you make of the US President, his Health Secretary's advice on Tylenol, what we call paracetamol here? Does it cause autism? What's your advice to people here who are...
Oh, look, I think my advice is follow Health New Zealand's advice, and I think their website says paracetamols are a safe medicine to use. Obviously, if anyone's got any questions, they should obviously always speak to a health professional. That's the right person to talk to in regards to any medicine.
So, what do you make of possibly the most powerful person on the planet, the most influential, giving this sort of advice?
Look, I'm the Minister of Health in New Zealand. We have health experts here. We have Health New Zealand who provide very clear advice on these medicines, and ultimately if patients have questions, the best person they should talk to is their GP. But I'm very much focused on New Zealand. In terms of questions of foreign affairs, I suggest you put those to my good friend, the Right Honourable Winston Peters.
Can I just ask about the timing of this? Because the advisory came out yesterday at 5 o'clock, and then it was an announcement this morning. Is it because of Paddy Gower's got issues?
No, this has been something that's been worked on for some time. It's been, I think Mike could probably talk to the amount of work that's been going on by Health New Zealand to put this together, to make sure that we can deliver a really successful program. And ultimately, this is about, the next step is actually making sure this does deliver for patients. But look, I acknowledge, Paddy Gower is been doing a lot of work in the space around bowel cancer, and obviously increased access to colonoscopies is a key component to the government being able to get the age for bowel cancer screening down to 45. We've made a commitment that is where we are going. Increasing access to colonoscopies is clearly part of what's needed to achieve that. and there's further work underway in that space. We've got modelling underway around what's needed to do that, and we've also got the fit for symptomatic test approach, which will shortly be, there'll be further announcements on that to again increase access to colonoscopies.
Because even with those that you're putting in for colonoscopies, it's what, 7,100 more colonoscopies a year?
Yeah.
When do they start?
Well, the program effectively starts immediately. I think sort of from next month would be from October is when it really cracks in. But ultimately, what we are, I mean, I'll get Mike just talk to the work that's been underway putting this together.
The wait list is 20,000 that I'm getting at, and you guys are only boosting it by 7,100.
Yes, again, there's different wait lists for different categories. So the urgent category is people who urgent have to be seen within 14 days. There's then people on routine examinations as well who have longer. So they have different categories for different patients, but I'll get Mike to talk to that.
So look, I think, as Minister says, this has been a program that we've been working on for several months. I think we've been really careful to make sure we build the system as well as we deliver extra diagnostics. I think in terms of colonoscopy, as Minister Brown says, we need a combination of the fit testing as well as the diagnostics, the colonoscopies. And this is on top of our baseline activity. We're also constantly working to deliver more with what we have, of course, and improve efficiency across our system. So this is in combination with that. And so, I think this program has been, a few months certainly in the making, trying to make sure that we do this in a way that delivers the most for all New Zealanders, and to use the money that we're putting into this in the most effective and efficient way.
When will the poop tests be available? Sorry, the fit tests, the at-home poop tests, and will it be for people who are 60 or 58, whatever the new age is, or will it be for people who are younger?
It'll be for people who are younger. So we're going to have further announcements on that shortly. That is the intention for Fit for Symptomatic is to effectively allow for those patients who are under the age of the bowel cancer screening age to be able to be referred for a Fit for Symptomatic. So effective, if they've got symptoms, they can get a test. And so we'll have any age. So there'll be more to say on that very soon. Yeah.
Do you support it for Māori and Pacifica at a younger age than Pākehā?
Well, the Fit for Symptomatic test will be for everybody. So it'll be about making sure that access is there for all New Zealanders.
Minister, the Association of Medical Specialists strikes just wrapped up. What's your action there?
Oh, look, I've been very clear when it comes to strikes that striking's not the answer. It affects thousands and thousands of patients. This week, over 13,000 patients had their elective surgeries, their specialist appointments, diagnostic procedures deferred. These are patients who've been waiting too long, and it's frankly unacceptable that the union's putting, striking rather than continuing to bargain. That's what they should have done. And just put it in context. The union, on the day that the union rejected Health New Zealand's latest pay offer, they began balloting their members for an additional strike. They didn't even return to the bargaining table. They started balloting immediately. That doesn't show to me that they're acting in good faith. And my message to them is that they should be putting patients first, get back to the bargaining table. Health New Zealand's put a good offer on the table of it's valued at 160 million over a 16-month period. It's a good offer. They need to work with Health New Zealand rather than simply putting patients' care at risk.
Sarah Dalton says that they want to go back to the bargaining table, but they're waiting for this ERA application to come through, which they think will fall short. I guess if it does fall short, what's the plan from there?
Well, ultimately, this needs to be dealt with around the bargaining table. That is exactly why Health New Zealand put a new offer to them, which they rejected and decided to continue with the strike. I wrote to Health New Zealand and to the union, and I said to them, asked both parties to enter binding arbitration, which would have allowed for a deal to have been done, set by an independent mediator, which would have been binding on Health New Zealand to resolve this dispute. The union rejected that in favour of a strike. So there's been a number of opportunities for the union to try and resolve this without having to delay the care for patients, and on each occasion they've chosen to strike rather than come back to the table. So my message to the union is get back to the bargaining table, work with Health New Zealand, rather than continue to disrupt the care of thousands of patients. And those patients, when it comes to hip operations, knee operations, there's patients in pain waiting too long. People with cataracts waiting and having their care deferred. People needing critical first specialist appointments so that they can then get on a treatment pathway. those wait lists ballooned significantly under the last government. We have now put the targets in place to address those. But the best place to deal with these issues around pay is around the bargaining table rather than striking.
Do you have a set time frame that you'd like to see it wrapped up at by the very least?
Well, it needs to be done as soon as possible, and that's why I wrote to the unions suggesting, and to Health New Zealand, requesting both parties to agree to binding arbitration. Health New Zealand agreed, the union rejected it. So the question to them that you should put is, why do they refuse the opportunity to get this dealt with by an independent mediator? That is a question that they have failed to answer.
Minister, just on the 75,000 extra procedures, how many of those, what percentage will be outsourced to private?
That'll be district by district. And again,
Do you have an overview?
no, so the answer is the funding will be made available to the Health New Zealand districts, and they will then work with their teams to look at what capacity they've got to increase through what's called insourcing, which is effectively working with their own equipment and staff to make sure they're maximising capacity in terms of their internal teams, and also outsourcing. So where there isn't additional capacity, they can then outsource to private providers.
So broadly speaking, are we expecting to see more outsourcing to private with this additional 65?
It'll be a mixture of both, but I'll get Mike to talk to that.
Yeah, so I think the short answer is yes, there will be more outsourcing and there will be more internal delivery. So I think that through different modalities, if you look at in different districts, as Minister says, there's different situations. So we need to build the right program in each place and make sure we're treating these patients more rapidly. A good example is echocardiography, which isn't going to be outsourced. So we're going to need to build internal capacity. Hence, as Minister's announced, the plans to build our workforce and make sure that we do a better job of using our resources. A different situation probably in some places around MRI, for example, where a combination of outsourcing and internal delivery will be used.
On that workforce thing you touched on, of the 65 million, how much of that is going into workforce?
Yeah, so look, we'll work our way through that. I think that's a combination. So I think it's going to differ by district. At the moment, we've got some workforce plans, but I think the exact split of that, I don't have the answer to that yet. We're going to keep working with our districts to make sure we do a good job of that, and it'll depend a bit on recruitment and the timing of those things. So I think some complexity in planning, but we want to build internal capacity and use outsourcing where it makes sense.
Dr. Shepherd, did Health New Zealand come under any pressure from the government this week to announce this today?
No.
You scrambled this together to announce it today?
Not at all. So as I say, we've been working on this plan for several months. We've had signals around funding. We've taken it to our board to sort of continue to work up this program. We've obviously worked with our teams, our national clinical networks, including the cardiology network, the radiology network, and our planned care teams to build this plan. It's obviously got significant elements contained within it around building our workforce. We've made decisions around trainees for next year, for example, that we've signalled to teams. So you'll see that this has been a plan that's been in the making for many months, and in fact, if you were to talk to our radiology clinical network, they'll say they've been waiting for this and really keen to get this moving for probably a year. So it's got a lot of background to it.
Great. Thanks so much, everyone. Appreciate it. Thanks for being here.